Agenda: skin disorders, pigment disorders of skin, hypertrophies of skin cancer, acne problems. Lesions of the skin are markers on skin or structural changes in epithelial tissue caused by injury or disease. Primary lesions are characterized by different color than the skin and or are raised above the skin surface. A wheal is itchy, swollen lesion lasting only a few hours caused by an insect bite, sting of a plant like nettle, or skin allergy. Also by a blow or pressure. A bulla, a fluid-filled blister caused by friction. A cyst, a closed, abnormally developed sac containing pus, semi-fluid or morbid matter above or below the skin. Macule, small discolored spot or patch on the surface of the skin like freckles. Nodule, a small swelling or a bump that requires medical referral. Papule, a raised bump, red colored due to pressure swelling. Also can be brown and pink and can cluster together into a papular rush. Pustule, a small blister on the skin containing pus. Tubercle, an abnormal rounded solid lump above, within, or under the skin, larger than a papule. Tumor, an abnormal mass of cells varying in size, shape, and color. Vesicle, similar to bulla but smaller, it is a small blister with clear fluid that lies within or above the epidermis, like poison ivy vesicles. Secondary lesions. Crust, dead cells that form over a wound or a blemish while it is healing. Excoriation, skin abrasion produced by scratching or scraping. Fissure, crack in skin penetrating into dermis. Keloid, thick scar resulting from excessive growth of fibrous tissue. Scale, thin epidermis flakes, oily or dry. Scar or cicatrix, slightly raised mark on skin after an injury has healed, light in color. Ulcer, open lesion on skin, might contain pus and loss of skin depth. Conjunctivitis is bacterial infection of the eye, pink eye. Dermatitis, inflammatory condition of skin with lesions. Eczema is an inflammation of skin of acute or chronic nature with dry or moist forms accompanied by itching or burning sensation. Herpes simplex, a virus infection, also called fever blister. Impetigo, bacterial skin infection, mostly seen in children, is characterized by weeping lesions. Psoriasis, chronic inflammatory skin disease, mostly found on the scalp, elbows, knees, chest and back. The cause of the disease is unknown. Disorders of sebaceous oil glands. Millia, keratin-filled cysts that appear under the epidermis, have no visible openings. Comedones, also called blackheads, is a hair follicle filled with keratin and sebum. Acne, chronic inflammation of sebaceous glands from retaining secretion and bacterium called propionibacterium. Sebaceous cyst, a large producing pocket-like lesion filled with sebum mostly seen on scalp and back. Seborrheic Dermatitis, oily, dry, itchy skin condition caused by inflammation of sebaceous glands. Rosacea, chronic inflammatory congestion of cheeks and nose. Disorders of sudoriferous sweat glands. Anhidrosis, lack of perspiration. Bromidrosis, foul-smelling perspiration. Hyperhidrosis, excessive perspiration. Milliaria rubra or prickly heat, acute inflammatory disorder of sweat glands by an eruption of small red vesicles. Pigment disorders of the skin. Hyperpigmentation, darker than normal patches. Hypopigmentation, absence of pigment, light or white patches or spots on skin. Albinism, congenital hypopigmentation, absence of melanin pigment on skin, eyes, hair, and body. Congenital means people are born with it. Chloasma is increased deposits of pigment in the skin, mostly caused by UV rays of the sun. Leucoderma, light abnormal patches in the skin caused by a burn or congenital disease that destroys the pigment producing cells. Nevus is a birthmark. Stains are abnormal brown skin patches having circular or irregular shape. Tan, change in pigmentation of skin caused by sun exposure. Vitiligo, hereditary condition caused by hypopigmentation, light patches on the skin. Hypertrophies of skin, abnormal growth of skin. Keratoma is a callus. Mole is brown spot on skin which is raised. Skin tag, flesh-colored outgrowth. Verruca is a wart, which is an infection. It is highly contagious, and cosmetologists should not work. Skin cancer. Basal cell carcinoma. Most common and least severe, characterized by light or pearly nodules. Squamous cell carcinoma. More serious than basal cell, characterized with scaly red papules and nodules. Malignant melanoma. Most serious form of skin cancer has black or brown patches on skin with uneven texture. Refer the client to a physician if a mole evolves in asymmetry, border, color, diameter, and keeps changing. Factors for aging: genetic, gravity, facial expressions, sun exposure, smoking, drinking, illegal drug use, stress, poor nutrition, polluted air. Ultraviolet rays of sun have the greatest impact on how the skin ages. Avoid sun exposure without sunscreen. Wear hats and protective clothing for outdoor activities. Protection from bacterial and viral infections. Wash hands for 20 seconds using antibacterial soap. Use gloves and eyewear. Wear a mask and protective clothing.